Hepatitis C, the silent intruder. About. Hepatitis C, often referred to as HEV, is a stealthy and insidious virus that silently infiltrates the human body, gradually wreaking havoc on the liver. This chapter delves into the intricacies of hepatitis C, exploring its transmission, symptoms, diagnosis, treatment, and prevention. The culprit, hepatitis C virus. Hepatitis C is caused by the hepatitis C virus, a member of the Flaviviridae family. This blood-borne pathogen primarily targets the liver, leading to inflammation and, in some cases, long-term liver damage. Transmission. Understanding how hepatitis C spreads is crucial to its prevention. The virus is primarily transmitted through blood-to-blood contact. This is the most common mode of transmission. Sharing needles or other drug paraphernalia, using contaminated medical equipment, or receiving blood transfusions or organ transplants from infected donors can all lead to infection. Unsafe medical practices, inadequate sterilization of medical instruments, particularly in developing countries, can expose individuals to HEV. Mother-to-child transmission. While rare, it's possible for an infected mother to pass the virus to her child during childbirth. Sharing personal items. Sharing items like razors or toothbrushes that might have trace amounts of infected blood can also pose a risk, though it's less common. Symptoms and progression. Hepatitis C is often called a silent disease because many infected individuals remain asymptomatic for years. When symptoms do occur, they typically manifest as fatigue. Persistent and unexplained tiredness is a common early symptom. Jaundice, yellowing of the skin and eyes due to liver dysfunction. Abdominal pain, discomfort or pain in the upper right abdomen, where the liver is located. Dark urine and pale stools. Changes in urine and stool color are often indicative of liver problems. Loss of appetite, a reduced desire to eat can lead to weight loss. Chronic hepatitis C can lead to severe liver damage, cirrhosis, scarring of the liver, and even liver cancer if left untreated. Diagnosis. Diagnosing hepatitis C typically involves blood tests to detect the presence of the virus. Two key tests are HEV antibody test. This test checks for antibodies to the virus, indicating whether a person has been exposed to HEV. However, a positive result does not confirm current infection, as some individuals clear the virus on their own. HEV RNA test. If the HEV antibody test is positive, the HEV RNA test is performed to determine if the virus is actively replicating in the body, confirming current infection. Treatment. The landscape of hepatitis C treatment has evolved significantly in recent years, thanks to the development of direct-acting antiviral (DA) medications. These highly effective drugs target the virus directly, achieving cure rates exceeding 95%. Treatment typically lasts 8 to 12 weeks, and it's crucial to follow the prescribed regimen diligently. Prevention. Preventing hepatitis C infection is paramount, especially given its silent progression. Here are some key preventive measures. Avoid high-risk behaviors. Do not share needles or engage in risky sexual practices. If you are a healthcare worker, follow strict infection control procedures. Be cautious with personal items. Do not share razors, toothbrushes, or any personal items that could potentially carry infected blood. Get vaccinated for hepatitis A and B. Protecting yourself against other forms of viral hepatitis is wise, as co-infection can worsen the outcome. Screening and testing. High-risk individuals, such as those who've injected drugs or received blood transfusions before 1992, should undergo regular screening. Hepatitis C is a formidable foe, but it is a battle that can be won. Advances in medicine have given us the tools to effectively treat and cure the infection. However, prevention remains the most potent weapon against this silent intruder. By understanding the risks and taking appropriate precautions, we can reduce the burden of hepatitis C and work towards a healthier future.